An ideal candidate for a combined breast and abdominal procedure is a patient who's usually of very sound, I'll start again. A good candidate for a combination breast and body, usually tummy procedure, is usually a female who is of sound mind, sound health. From a sound mind perspective, they have realistic expectations of the result that could be achieved. From a health perspective, they're usually someone who maintains a good health and lifestyle. That includes a healthy weight that they've maintained for some time, at least for about 6 months. And they're someone who doesn't have other medical comorbidities, or at least that they've looked after them quite well. We usually encourage them to not be a smoker and to have their other medical conditions controlled. With respect to how they present, it'll usually be a patient who, from a breast perspective, will be after increased volume, better shape. That could be through the insertion of implants with or without a lift. Some of our patients, though, have a very large breast size and they might be looking for a reduction to improve their neck pain and back pain. From a tummy perspective, our typical patient is someone who's had kids in the past. Pregnancy has caused their rectus muscles to separate. They've really looked after themselves to try and achieve the muscles to come back, but that hasn't worked completely. And so what an abdominal procedure or a tummy tuck would achieve is to remove the loose skin and tighten those muscles. For the right patient, it's an excellent surgical procedure that takes about 5 to 6 hours and comes with a short hospital stay. There is a few weeks of recovery afterwards, mainly to do with the abdominal procedure, which means that they can't lift heavy weights for about 6 to 8 weeks. After that, though, they return to normal and the results can be outstanding and, more importantly, long-lasting. It's a really rewarding procedure, both from obviously the surgeon who appreciates their patients being so happy long-term. A recurring theme from my patients is that such an operation really not only improves the aesthetic outcome, but it really offers a functional benefit. They report a significant improvement in their back pain, their posture, and their capacity to do physical exercise.